Warm greetings to one and all. Let's wait for a couple of minutes while we admit the rest of them. Hope you can hear my voice clearly. So once again, this is Dr. Anita Sarjan, your MC for the session. If you wish to claim your certificate for the same, kindly visit our website, which is www.onlinedentistry.in/9 p.m. and register for the same. Online dentistry has been the pioneers in providing dental education via both online and offline platforms. It has been over 14 years that online dentistry have been conducting sessions for clinical practitioners across the globe. Established in the year 2008, so far we have covered over 203 offline courses and have conducted 1,022 online courses with an enormous amount of more than 30,000 followers on our platform. Let me proudly introduce the CEO of online dentistry, Dr. Binuti Abraham. He's one of the finest practitioners in town, an orthodontist by profession, a passionate photographer, and he owns his private practice at Kerala Dental Clinic, Alva. Moving on to the academic head of online dentistry, Professor Dr. Joby Peter. He's currently the HOD of Department of Pediatric Dentistry at Anu Dental College, who preaches the philosophy to catch them young and watch them grow. Over the years, we have grown dynamically, launching 10 centers in different parts of India. On popular demand, we are launching our next 3-day series on November 24th, 25th, and 26th at Cochin. We are open for fresh registrations via our website. The latest addition to our courses, the 1-year comprehensive and advanced master training program on interceptive and myofunctional orthodontics, have been successfully initiated with 2 batches. This is a multidisciplinary approach with intense training and hands-on session. Our program is now a fellowship program on interceptive and myofunctional orthodontics, which is accredited by the Manipal University College, Malaysia, which is also a sister concern of Mahi University. Herein, 2 of the modules will be happening in Malaysia, along with the graduation ceremony and certificate distribution as well. We are a batch full, completing a record of 15 registration and awaiting registrations for 2024 batch. You can always feel free to reach to us on our WhatsApp number or visit our website, which is www.onlinedentistry.in, or else you can mail us on onlinedentistry.in@gmail.com. Online dentistry have been conducting sessions all over India for the past 14 years. During the lockdown, we started conducting online sessions to benefit the practitioners, which have been received with great appreciation from the dental fraternity. In the year 2023, we are relaunching the same by providing free advanced learning series under the title Online Dentistry at 9 p.m. Without further ado, let me move on to introducing the speaker for the day, Professor Dr. Betsy Joseph. She secured her BDS, MDS, and PhD from Government Dental College, Trivandrum. She's done her MFAs RS Glasgow, FEA, and FICD from International College of Dentists. Owing to over 15 years of experience and expertise in managing various periodontal conditions and treatment modalities. She's also accomplished several funded and non-funded research projects. According to a strong record of consistent academic and professional achievements, and also she's accredited with numerous publications and research papers. Ma'am, Online Dentistry proudly welcome you tonight, and the session is all yours now.
Thank you, Dr. Anita.
Welcome, ma'am.
Good evening, one and all of you, and warm welcome to this session. At the very outset, I would like to thank Joby Peter, sir, from Online Dentistry for giving me this opportunity. And I would also like to thank Dr. Joe and Dr. Anita for coordinating this beautifully. So today, I will be sharing some tips on scientific writing and publishing in dentistry. So before I proceed, let me tell you a little bit about my journey so you would understand why this is so important to me, and it will be to you after this session. So I studied BDS, MDS, and PhD in Government Dental College, Trivandrum. After that, I worked for a few years in Nurul Islam College of Dental Sciences, Trivandrum, then went to Saudi Arabia, and during COVID, I came back to India. and I'm attached to Savita University right now, Department of Periodontics. I'm also an adjunct faculty at Pushpagiri Research Center, Tiruvalla. Along with that, I'm a PhD guide at Manav Rachna University, Faridabad, and have collaborative projects with various international universities like University of Helsinki and University of Oviedo, Spain. Along with that, we have started in 2020 during COVID. We started exclusive dental research consultancy, which is Research Craft Consulting, which is a group of PhD qualified doctors where we train and support research requirements of academicians and scholars, research scholars. Yeah. About my, sorry. My research interests include periodontal regeneration, photodynamic therapy, salivary diagnostics, etc. And I have a special interest in scientific writing and publication strategies and quantitative research. And that's how I come to this platform to share with you things that I have learned over the last 15 years. So when it comes to scientific writing and publishing, we sometimes ask who should publish. Is it only the postgraduate students who should publish? But let me give you a list of people who should be publishing and the reasons why you should be publishing. If you're an academic researcher, you should be publishing. If you're an intern in many colleges, they look at the research you have done till the end of your internship so that you can secure a postgraduate seat. Postgraduates, as part of your research and your thesis, you need to publish. If you're a PhD scholar, you need to publish. Now, it doesn't end there. If you are a government employee or part of an NGO, you might have to publish various documents. A clinician needs to publish, independent researchers, medical writers. And what are the reasons for publishing? You would think that only you need to publish your thesis or maybe one or two research during your PG days and it ends there. No, in different part of the world, the requirements are different for your publications. It could be for getting a promotion, for getting a job appointments, to enhance your career, to advance your career, to get funding from various various institutes as part of your postdoctoral project, and of course the fame and glory that comes with high impact publications are really that you need that need to be addressed, and obviously for the good of science. Now, having said this, what do you publish? Again, you would think, okay, you have to publish a research paper. It could be a clinical trial or a case report, and it ends there. No, there's a big, huge list of things that you can actually publish based on your present situation. It could be an original research where you collect data from the patients, do statistical analysis, and then publish it. It could be a literature review. Now, literature review could be traditional review, systematic review, scoping review. You could also add a statistical aspect to it, and you could do a meta-analysis and publish it. If you're doing an experiment and you come up with experiment or a clinical study and you come up with some unique finding, very interesting, and you don't want to wait till the you don't want to wait till preparing the whole manuscript of 3,500 or 4,000 words. You could actually write to the journals with your findings as a rapid communication document. You could also write letter to editor, case report, case series. In fact, if you're a beginner, I always suggest that you start with a letter to editor and case report because it's easy to do. Now, these are the academic requirements. But if you're a medical writer, or if you're a dentist who's working in the pharmaceutical company, pharmacovigilance, again, there are documents like technical report, white papers, clinical trial protocols, regulatory documents, medical education and communications. A lot of documents need to be written. Scientific writing is needed for a lot of documents. Now, I'll be focusing just on academic writing. So the most common thing that we would write is a research paper. So let's just look at few things that you need to remember when you are writing a research paper. You could be a faculty member, you could be a postgraduate student, you could be a medical writer, you could be an independent scholar. Whoever you are, when you write your paper, your aim is to publish it in a good journal. When I say good journal, index journal, a referred journal. So first thing you need to remember is what you're doing is communication. the way I'm trying to communicate with you. So it's a communication, which means you have to make it very clear what you're trying to convey. For that, it's best to use short sentences, direct sentences. Make your sentences very clear. And always writing your research paper is not that it's not that you write a paper in a day and you publish it. It's a process of writing, rewriting, getting it corrected, having a structure to it, organizing it, having to decide what to include, what not to include, and coming to the form of writing. Different types of research paper has different forms. So most common is IMRAD. If you're a postgraduate student, you would have heard this a lot during a journal clubs. IMRAD is introduction, methodology, result, and discussion. And if you're a beginner, I would suggest that even in introduction, if you have 3 to 4 paragraphs, have one paragraph which contains one idea. The next paragraph could contain next idea, so it will be easy for you to write. So one para, one idea is a good thing. Now, if you see certain journals like Scientific Reports or Nature, you would see that always IMRAD is not followed. Sometimes it would be introduction, then result, discussion, and methodology. You might see it in the end. Sometimes you have introduction, methodology of a particular result, then give the result and discuss it. Go to the next part of the result and discuss it. So there are different formats of writing scientific paper, but if you're a beginner or an intermediate researcher, no need to worry about that. Follow the IMRAD format as long as you're writing your original research. If you're writing original research, now when I say original research, it could be a cross-sectional study, a cohort study, a case control study, or a clinical trial. Typically, these are the parts of the research paper that we have. Where introduction, you are motivating the reader. So the way you write, it has to be like a story, one leading to the other, so that when the reader goes through your introduction, he understands why are you doing this study, and the end of the introduction should be the aim of your study or objective. And I hope you can see how the triangle is inverted in introduction. We will discuss it when you're talking about discussion. Then comes methodology, where you explain in your paper, how did you do your study? What was done? When was it done? How was it done? All those details you will give in the methodology section. Then coming to the result section, you are going to write only what you found. You're sharing the data with the reader. You're not going to give explanations in result section. Why was that found? That will be done in the next section. Okay, so result section, you will write what you found. Then comes the discussion section. Do you see the triangle is upright in discussion? Because in discussion, you start with something very specific, the results of your study, and then go on to expand your discussion, and you will discuss more about other studies that are in favor of your findings and studies which are different from your findings. And if studies are different from your finding, you would discuss why, what was the reason that these studies are different from your findings. And then towards the end of your discussion, you will explain about the generalizability of the study. Then you will give recommendations, future potentials of your study, strengths and limitation before future potential. And then you would end your paper with conclusion. So these are the basic components of a research paper. But if you're doing a systematic review and a meta-analysis, you would go a little differently, because you need to conduct it and you have to write it and you have to use a PRISMA checklist for that. So when you do a systematic review, you have to identify your focus question, then prepare a protocol. Then you have to do a literature search. You have to screen the studies. You have to extract the data from these studies. Then you have to do a critical appraisal of these studies. And then you do the manuscript preparation for your systematic review and meta-analysis. Now, having said this is something you all must be doing these things, and you must be wondering, what is Dr. Betsy repeating the same things which we know? Now comes the next part, the important part. Just writing, conducting a study and writing is not enough. If you have to make it publication worthy, you have to take care of all the nuances. You have to take care of all the fine details, including that the dot, the full stop is put after the last letter without a space in between. I hope you understand how critical these things are. So let's see I'll give you some tips on how to improve the quality of your manuscript so that you can reduce the chances of rejection, so that you can increase the chance of rejection. So the first thing is, choose your whichever study design you are planning to write. Go to this website called Equator Network. Okay, Equator Network is enhancing the quality and transparency of health research. So go to this website, and there's a lot for you to explore. One main thing is that you can find reporting guidelines. For example, if you plan to write if you're writing a clinical trial manuscript, you should go to this website and take out your consort checklist. These are called reporting guidelines, and prepare your manuscript based on this particular guideline, which means you will not miss out on any of the points, any of the important point, whether it's in the introduction part, in the methodology, result, or discussion. Same way, if you're writing an observational study, it could be a cross-sectional study, cohort study, case control study. You could go to this website. Even if you don't go to this website, go to Google and type STROB checklist. You will get the PDF or the Word format where each and every checklist item will be given, based on which you will prepare your manuscript. Or else come to this website, and all these things are downloadable. And the beauty of it is, this website also gives you explanation of each of these checklists on how to use it. Same way, if you are doing a systematic review, you have to use a Prisma checklist. Now, again, if you're losing track of what I'm telling you, you use these checklists to write your manuscript. Okay, and again, if you're doing an animal study, there are certain checklists. If you're doing a case report, now this is something I realized very late, that even to prepare a case report, you have a checklist. This is just an example of a reporting guideline checklist which you will use when you're writing a case report. So if PG students are listening to this, or faculty members are listening to this, please note that even if your students are writing a case report, please ask them to use this CARE checklist. Where will you find it? You will find all these checklists on this website called Equator Network. So there are points given which you have to include in your write-up. Clinical findings, timeline, the diagnostic assessment that you did, the therapeutic intervention that you did. After the therapeutic intervention, did you do any follow-up? You have to write a discussion in your case report. And what was the patient's perspective? All these details need to be mentioned, included in your manuscript, and you have to write the page number where each item appears at the left side of these checklists. So you can find all types of checklists on Equator Network. That is if you're writing a case report. If you're a beginner, write case reports and letter to editor, gain experience, and then write tougher papers. Now, if you're writing a clinical trial, you can take a screenshot of this if you want. If you're writing a clinical trial manuscript, you have to use a consort statement, which is consolidated standards of reporting trials. Then if you're writing a observational study, you can use STROB, and STROB has modified versions for cross-sectional studies, case control, etc. And if you're doing a systematic review and meta-analysis, use Prisma. Again, very often, I have seen students and even faculty members, because I told you, along with my academic and clinical practice, we do run a consultancy where a lot of faculty members and clients contact us. Sometimes it's to help them help them with research. Sometimes it's to review their paper. Sometimes to edit their paper. So what I've seen is very often flowcharts are missing. It's very important whenever patients are involved, you have to give a flowchart. That should be a figure 1 for your research paper. What you see on the right side is a Prisma flowchart that you will prepare if you're doing a systematic literature review. What you see on the left side is a flowchart of patient recruitment if you're doing a clinical study. All right. Now, if you want to understand more about Prisma flowchart, how to use these Prisma flowchart, you could type in Google, you could type Prisma and actually prismastatement.org, and this page opens up. Again, as I told you that in Equator Network, you have to explore a lot. Same way, in this website, there's lots for you to explore about Prisma statement. In fact, if you're doing a systematic review, you have to use the latest Prisma checklist, which is Prisma 2020. The first checklist came in 2009. So nowadays, journals don't accept old checklist 2009. So they expect you to prepare your systematic review based on the latest checklist, which is Prisma 2020. So do explore this site also. Right. Now, one more thing, because a lot of people are nowadays trying to do systematic review. There's a lot of requirement to publish systematic review, especially if you're a PhD student. The first paper that we ask our PhD students to do is a systematic review. So you need to know that you have to explore this website to get all the necessary checklist and flowchart templates. Then this is the website where you will register your Prisma protocol, not Prisma protocol, where you will register your systematic review protocol. This website is called Prospero. Just like you have to register your clinical trial, like in India, you have CTRI, every country has their own clinical trial registry. Same way, if you're planning to do a systematic review, first step is to establish a research question, and the second step is to prepare a protocol. And the third step comes here. Third step, you have to register your protocol on Prospero check website if your systematic review is related to health related outcomes. And what will happen in about 2 weeks, you will get a Prospero registration, and this number needs to be quoted in your manuscript when you are writing the methodology section. Journals ask for it. So that is about Prospero website. Yeah. Now, I told you that just preparing a manuscript is not enough. You have to use a checklist. Now, again, something very important is just writing the scientific details is not enough. You have to pay attention also about general writing. Now, these are the things I really learned during my PhD days, where I had very nice supervisors who made sure that it's not only the scientific part that we're writing, also our general writing skills are improved. So what you have to remember when you write a paper is that your paper has to be easy to understand. I think we Indians generally have a tendency to make complicated sentences, and we think it sounds very intelligible. No, keep your sentences easy to understand, short, simple. Use appropriate tenses. In methodology section, what you use. In results section, in methodology section, what tense do you use? You're telling what you did, so you will use past tense. In results section, you will use again past tense. You found this. But when you talk about tables, you will say table 1 shows. You don't say table 1 showed. Why? Because in the manuscript already table 1 is there. So you have to use appropriate tenses, active and passive voices. And another tendency is that sometimes students create their own acronyms. No, you are supposed to use only standard acronyms, and many journals expect you to give a list of acronyms at the end of your paper. So go through the format of a paper from a journal where you're planning to submit. We'll come to that. Then another thing I want to include as part of general writing is avoid repeating phrases. By the way, sometimes you can see students write by the way, by the way. So avoid those phrases. So do take care of general writing. Another very important thing is references. You have to make sure that you have not only written a scientifically strong and valid paper, you have to make sure that your general writing aspects are good. Along with that, you have to make sure that your references are correct. References are correct in terms of the format of the journal, in the text, in the main text, and also in the bibliography section. Now, you also have to be careful about including recent studies. If you're publishing a paper in 2023, you should not be having references only from 70s or 2000s. Now, 2023 means last 3 to 5 years. References from last 3 to 5 years also need to be included. So there is no hard and fast rule how many references should be there from last 3 to 5 years and how many should be there from the old studies. But generally, you could, have something like 60 to 65% of recent studies, 3 to 5 or 3 to 7 years, and then remaining studies could be old classic studies, which you have to mention. So that is about the references, and this is typically the body of the reference where you have to mention this, especially for PG students who are starting off. Do not eliminate these things. Everything should be there: the last name, the initial of the author, the year, the title of the article, the journal where you are, academic journal where you're published, it is published, the page number, volume number, issue number, and DOI. What is DOI? Digital Object Identifier. This is like you have a Aadhaar number for each one of you. Same way, every article has a DOI, which is unique to that number. Okay, now, do not sit and manually add references. I know a lot of people, so when I conduct these workshops, a lot of people attend it, including students and faculty members, and it's sad to see how even now many faculty members are also, like senior members, are also manually adding references. No, please make use of technology. It saves a lot of time and effort and makes your work perfect. So use referencing softwares. Free would be Zotero and Mendeley, but if your university has EndNote, nothing like it, that's the best referencing software. It makes life very easy for you. So next time you write a paper, do use these reference managers, and if you don't know how to use it, just go to YouTube. Each and every referencing software has been explained in detail in YouTube, how to use it, how to install it, and how to use it. Okay, the advantage is, see, I think you know it, but let me just tell you that if you are writing 1 to 30 references and you have to delete reference 10 for some reason, your supervisor tells you, or you find it inappropriate, once you remove 10, what happens? 11 has to become 10, 12 has to become 11. And I have done this manually long time back when we were not aware of these things. So now I use EndNote. So the thing is, if you use EndNote, deletion of one reference automatically is taken care of by the reference. 11 becomes 10, 12, because you don't have to do anything. Again, if you submit a paper to a journal and for some reason, if it gets rejected, because rejection is very common when you do your research and publication. So if it gets rejected and you have to resubmit it to another journal, if you're using these softwares, there are options in these softwares to just click on one button and the journal format. For example, from Journal of Dentistry, you want to submit it to Journal of Pedontology. Click on Journal of Pedontology and all the references automatically changes. So please do use this. And if PG guides are listening to this talk, please encourage your PG students and interns to use referencing software next time they write the paper. Now this shows how important punctuations are. Instead of let's eat grandma, it's always safe to put a comma and say let's eat grandma. So make sure that you avoid grammatical mistakes. Recheck and double check your paper before you send it to the journals. Paid version of Grammarly will really help you check the spellings, remove redundant material, takes care of punctuation, apostrophe, and all those things that you need to make sure that your paper is having good English language. So do use Grammarly, but do use a paid version. The free version does not take care of all these aspects. So this is just, I've taken a screenshot of Grammarly, how it works. It will give you options of, instead of greater, it will show you whether you want to select more significant. If you give yes, it will select. So do use Grammarly to check your language. Again, plagiarism. So again, PG students, I've seen at times they read the paper and then they copy paste and write it. No, you're not supposed to do that. You're supposed to read a matter from a particular paper and rephrase it and write it in your own words. Because when you send your paper, after taking care of all the things that we discussed, when you send it to a journal, they do run it through certain softwares like Authenticate, Turnitin. They don't generally use Dupli-Checker. It's Turnitin or Authenticate. We use Turnitin. They check, and reports like this come up, and anything more than 15 to 16% is not usually accepted. Sometimes you might even face desktop rejection because of these things. So do take care of your language, do take care of the plagiarism aspect, do run it through these softwares before you send it to the journal. And if you see that the similarity index, which is a polite way of saying plagiarism, similarity index is high, and do you see on the left side, on the right side, how it is highlighted? Those things are the sentences which are similar to the already published articles. Many times you can rephrase it and reduce the similarity index. Now, this is something that I found very interesting on LinkedIn. In fact, you all should be following this Dr. Asad Naveed in LinkedIn, where he comes up with a lot of posters like this. So simple methods of how to reduce plagiarism. Is it your idea? If it's not your idea, put it in quotation mark, and give appropriate references. So these are all things that you can do to reduce plagiarism. Another thing is, nowadays there's a lot of artificial intelligence based tools available to help you in scientific writing. Some of these that you can see on the screen are literature mapping tools like LitMap, Research Rabbit, Connected Papers, etc. So do explore these and see how you can make use of it to improve your paper. Again, these are some tools that you can use for your academic writing. All these, so go to LinkedIn, log into LinkedIn and go to the page of Asad Naveed. You can always visit my page also, but Dr. Asad Naveed is based in Canada and he writes excellent posts. So do go through that, where he gives you a lot of insights about different tools and different techniques that you can use. For example, you see, like to do illustrations, in your research paper, you could use Canva, BioRender, Draw.ai, a lot of things. So do explore these pages also on LinkedIn. Coming to the ethics and integrity part, you have to make sure about the authorship gifting. It is not acceptable. So you should not be just gifting authorship. You should only be putting the names of the people who have contributed. Again, PGs, anyone who does the paper, does the research, maximum part of the research should be the first author and not the PG guide or the senior member of the team. It is the person who has done the maximum work who should be the first author. So there are there are rules and regulations about these. Please do go on publicationethics.org to know more about this. Now after this, when you submit a paper, these are all the documents that you need to check and make sure that you have before you submit your paper, like the title page, the abstract, main text, ethical approval statement. Do take a screenshot of this page. Author's contribution, funding details, references, or data availability statement, and an impressive cover letter. Okay, so these things should be there when you're submitting a paper. Now, this is an interesting read. Again, you can take screenshots of all this. So this is an interesting read, which is a scoping review about common errors in biomedical journals, where they give you a list of reasons why papers are usually rejected. So that brings, so do go through that. And now that brings us to the next topic of where to publish. There are various aspects that you would consider when you want to select your journal: the aim and scope of the journal impact factor, indexing of the journal. All this depends on, like, for what are you publishing? Are you publishing it just to improve your CV? Are you publishing it for funding? Are you publishing it to get promotion? In those cases, do check with the requirements of those authors and publish in suitable journals. Most important part you need to check is that the publisher is not a predatory publisher. I think when you open your emails, you get emails which tell you that we've read your paper, it's very interesting, send your next paper to us, and within 1 week we will publish it. No, it doesn't happen that way in credible journals. So do make sure that the paper you're submitting to a journal, that the journal is a credible journal. This is an interesting editorial, publish and be damned. This tells you the damages of predatory publishing. Do read it. It's by W. Angus Waltz, 2006. Publish and be damned. Then when you select a journal, you see this, always go to the various parts of the journal to see if it's a genuine journal, especially go to the abstracting and indexing section and check where all are these papers indexed. What we want usually is we want our paper to be definitely indexed in PubMed, Scopus, and a higher level would be Clarivate Analytics, Science Citation Index. So like when we were in the Middle East, to get promotion, to get increment, to get a lot of things done, to get funding, you need to publish your paper in Science Citation Index paper journals. So you need to make sure that your journal has these credibilities, because it improves your recognition, improves your visibility and global audience of your paper, of your research. It improves your collaboration opportunities. Definitely, it helps you in career advancement, and papers published in Science Citation Index journals with impact factor have high quality, definitely. And institutions use this as a metric for ranking and funding decisions also. So it's very important to aim to publish in high quality journals, especially Science Citation Index journals, or at least in Scopus Index journal. If you want to make sure that your journal is one from Science Citation Index, you could go to this website called Master Journal List and type in your journal details, and it will come up whether it's a Science Citation Index expanded or not. For example, so where to publish? When you decide to publish in a particular journal, for example, you want to publish in Journal of Dentistry, go to that website, explore a lot of things, explore the editorial and guide for the authors. Like this is Journal of Clinical Periodontology. When you click on the aims and scope of the journal, you will read what kind of papers are accepted. Submit only if your paper is falling in that particular category. So you can avoid rejection this way. Then again, you read the impact factor, read about the editorial team, read about the author guidelines. These are all screenshots from a particular website of Journal of Clinical Periodontology. So whenever you decide to submit a paper, explore the journal and make sure that it's credible, what are the author guidelines, and prepare your paper exactly according to the author guidelines, and then click on the submit manuscript, where your paper goes in for peer review. What happens in peer review? Your paper goes to the editorial team, subject matter experts, review members, and editors go through the content, and if they find that it has got merit, it goes into the reviewer's hand, and they will decide whether it needs minor rejection, major rejection, whether it needs minor revision, major revision, or it needs to be rejected or accepted. That's how basically peer review process happens. Now, also you need to, when you select a journal, another very important aspect is sometimes you see open access. What is it? In open access, there are two types of publishing model. Open access model is when the author pays for publishing and the reader gets the paper free of cost to read. Access is free. Whereas the older model is the traditional model, where the reader pays and the author does not pay. And there's a hybrid model in some journals where both these options are available. And finally, if you are starting to do your research, you should, I hope by now you've already registered in ORCID. If you've not, go to this website, Open Researcher and Contributor Identifier, where you will get a number of yours. You can always quote it when you're submitting your paper, when you're submitting it for funding, and things like that. You can even use it while you're signing your letter. So this is again another another digital identifier number for a researcher. DOI, I told you, is for an article. Same way, this is a digital identifier for a researcher, which does not change. And all your research, wherever you have done, whichever institute, even if you've changed, all your research gets attached to this particular number. So today is your opportunity to build the tomorrow that you want. And if you have been thinking that you have to write, you've been thinking about writing, but you're having blockers, right? Writer's block. I hope after this session, you are inspired to start writing your paper. To know more about it, go to LinkedIn. Go to Editage Insight, go to Nature, go to ResearchGate. There are a lot of information available on different types of writing and different things that you can use while writing. And if you still have more interest in scientific writing, do read this book on Developing Skills in Scientific Writing by John Gibba. To improve the language, William Strunk and White follow this one. I personally follow this one by Karine McLean. Do go through this also. And as part of our ResearchCraft activities, along with research guidance, we do conduct workshops. So the next online workshop is on 26th November. Details of it is available on the website, which is www.researchcraft.in. And we also have upcoming scientific writing and systematic review workshops in Indian Institute of Health Management Research, Bangalore, Army Dental College, in Telangana, ITS Delhi, etc. So these are different projects that we are involved in as part of our consultancy. If you want to connect with me and know more about the activities, you're most welcome to connect with me on LinkedIn. Do send in a request and I'll be happy to help you in whichever way you want. Or you could read about my research papers on ResearchGate, or even go to Google Scholar and check out my publications. So thank you so much for your patient listening. I promised Dr. Joe that I'll finish at 9:42. It's 9:41. Thank you. Over to you, Dr. Anita.
Thank you, ma'am. Now you guys can post your queries in the chat box. Ma'am, the first question is that, will the PPT shared with the participants? Could you just share the PPT with the participants in the following session, ma'am?
Yeah, I could do that.
Okay, thank you, ma'am. The next question, it's not a question. Thank you, dear Dr. Betsy, from Dr. Sumit Varna. Very enlightening session, ma'am. Thank you, ma'am. Really super session, ma'am.
Thank you.
We've got so many thank you messages, ma'am.
Yeah, thank you so much.
Thank you, for the Panji session. Now, moving on, here we come to the end of the session. So stay tuned till the next second Wednesday for another Panji session from Online Dentistry. Thank you all. Good night.
Thank you so much. Bye-bye. Good night.
Ma'am, bye-bye. Good night.